So hello everyone, I'm Andrea. Some of you know me, some other don't. I'm part of the Global Health Next Generation Network as a project and partnership manager. We are a network of young professionals, and we are trying to help other young professionals to find their way in global health. For this, we are having three main projects: our conference in Barcelona every year, global health hangouts, which are informal meetings can happen throughout the whole world, and global health mentorship. And now this is our newest project, peer-to-peer sessions, where you will be having the chance to talk with people from our network who studied abroad or are working abroad and can give tips about how to get a PhD or a master, or just how you can study abroad. More information about our projects you can find on our website. I can put you the link on the chat, and then you can check it out later. In this talk, I will try to be very short. I will just interfere whenever is needed. And in order to make sure that everything goes smoothly, please wait until you can ask your question and let the speakers tell their story. If you want to ask a question, raise the hand, and then I will give you the word once there's a possibility. Also, we have the pigeonhole to facilitate the questions. I don't know if you already saw it, but I'm going to send you again the link, and then later on we can answer the questions that were already asked there. I will send you once again the link. Here you can see it now on the chat. Is everyone seeing the link? Okay, so now you can ask the questions, or just like the question that was already asked, and then we can answer it. And also probably we're going to have time to answer everyone's question, because we're not many people now. The speakers are going to be Viveka, who's part of our network. She's the project studying in Sweden. Mahima, who's our Secretary General. She's from India, studying in Norway, doing her PhD. And Nina, who's from Finland and studied in Sweden. Now she's back in Finland. And Sandra was also going to be a facilitator and helping out if it's needed. And she's from Spain, living in Spain. She studied at IS Global. So I will give now the word to Viveka, and she's going to tell you more about her story and how she went to study abroad. And she can answer your questions. Viveka, you can go ahead.
Okay, yeah. A moment, let me share my screen. I prepare a small presentation for you. Okay, so I'm Viveka, and I will be talking about studying global health programs in Sweden. So I would like to start by giving you a small background. So this is me. I'm a medical doctor originally from Mexico. And after finishing my bachelor, I went to the field as a clinical doctor for around 3 years. And then I decided I wanted to go back to school and do my master's. So I am now a second-year master's student at the University of Gothenburg. And I'm funded by a SI scholarship. And I'm also a Global Health Next Generation Network Projects and Partnership Supervisor. So starting going directly into the master's and the these are the master programs that have the name of Public Health and Global Health Studies in Sweden. Of course, there are many other programs that can be related to global health, but I chose these ones because they are the main ones. So Lund University is here in the south of Sweden, and they have a 2-year master program in public health. Then Karolinska Institute is more or less over here in Stockholm, and they have 3 different programs. So one of the programs is in global health. It's a 1-year program, and they have 2 programs in public health. So one of them is in biostatistics, and the other one is in health economics. Then Uppsala University is a little bit to the north of Stockholm. It's a student city, and they have recently moved from international health to global health. And they have an emphasis on maternal and child health. And then to the north is Umeå University. So in Umeå, you can have a public health magister, and this takes a year. And at the end of this year, you do a small thesis, or you can go for a public health master, and this takes 2 years. So you do a small thesis on the first year, and then you do another small thesis on the second year. And finally, Gothenburg University is more or less here, is the second largest city in Sweden, and they have 2 different programs. So one of the program is in public health with the area of specialization in health economics, and they have a second program in global health, which is the one I'm taking part in. So I wanted to share with you some links that I found that they're very useful. So in this first one, you get to browse all the programs, and they also have a lot of practical aspects about actually studying in Sweden, like information about the funding, how is the student life, for example. And then the second one is actually the application portal. And here you can see more information about the specific programs, the requirements, the deadlines, and it's in this one where you will actually upload your documents. And finally, in this last one here, you can check out the statistics about previous admission rounds. So you can get to know how many students applied, how many students got accepted, and also if they were of Swedish or non-Swedish background. So I will share the presentation with you afterwards so you can take a look into this with more detail. So for the application, you can select up to 4 programs, which you get to do the application at the same time. And of course, you need to verify the requirements and deadlines. So the general requirements for the master programs are you need a CV, letter of motivation, and now the format for the CV and the letter of motivation can change from one university to another. I know, for example, Karolinska and Lund have like a special format, and they require more specific questions that you have to answer for your application. And on the other hand, Uppsala, Gothenburg, and Umeå have like a more general kind of application. You also need a transcript of your last degree grades. And if you're not from an English native country, you need a proficiency test of English. So then you get to upload all these documents in the website I already mentioned. And it's very important that you prioritize the programs according to your preferences. Because if you're accepted to the first program, then you won't be considered for the next ones. And then after you upload your documents, you can start with your funding process. So the funding process is done separately, it's not in the same portal, and we will go more into detail. I will explain that a little bit later. The deadlines will vary according if you are from European background or not. For non-Europeans, the deadline is around December, and for Europeans, I think is end of February or March. You get your notification of results in April, and also it's the same for the funding, and then you apply for the residence permit. And I highly suggest that as soon as you get your notification, you also apply for accommodation, because it can be quite tough to get a place to live here. Okay, so moving on to the finance aspects of studying here in Sweden. These are the fees, and this apply for all the students that are not from European or Nordic or Swiss nationalities. So everyone has to pay an application fee of 900 kronor, Swedish kronor. And then as soon as you get your notification that you're accepted, you're expected to pay the tuition fees. So the tuition fees are of 129,000 Swedish kronor per year of studies. And if you're applying for a scholarship, then you submit the papers that you're applying for the scholarship, and you don't actually have to pay the tuition fees at that time. And if you need to apply for a residence permit, you will also need to provide a financial guarantee that you have at least 8,100 kronors per month per year of studies. And of course, if you're planning to travel with family members, then this amount will go up. This is just a little bit more in depth of how the living expenses look like in Sweden. So you need around 8,000 kronors per month to go by. But of course, this will vary according to your lifestyle or whatever. Okay, so I will move on about the funding opportunities and talk a little bit about my experience with the funding. So you basically have like 2 main ways to go with for the funding. So one of them is through the Swedish Institute scholarships, and these are divided in 4 different subtypes according to the country of origin. So the application is done through this website that I left here if you want to see more about it. And the requirements are not that many, like specific, but you do need to have some job experience. Now in this job experience, they're kind of broad in their definition, so it can be either volunteer experience or internships or an actual work in the field. And the Swedish scholarship is pretty cool in the benefits it has. So you get to participate in a network even before coming to Sweden. So they have different activities in different parts of the world. And these are like conferences and workshops, and they mostly pay like your traveling to the place and then your living experience during your living expenses during the time you're there. And then they also do the same where you actually studying here in Sweden. They will have like different conferences and workshops in different cities in Sweden. So you get to travel and know people. And even when you finish your studies, you're still part of this network. So you can organize yourself events worldwide. And okay, then moving on to the university scholarships. So all universities have their own scholarships, and this can come in two ways. So they can either be like a fee waiver or they can cover your living expenses. I haven't seen one that covers both. So you have to apply to one and to the other one separately. So it's not guaranteed that you will get the whole thing. And these ones are not all put together in one website. So you will have to browse into each university and see what options they have. Okay, so moving on to my own personal experience, I would like to introduce you to my classmates. So this is us, the first day of classes. As you can see, we're a quite small classroom. We were 16 classmates that started, and half of us are from international backgrounds and half of them are Swedish. And we got different funding. So I got a classmate that also has the Swedish Institute Scholarship. Some others are financed by their own governments or Ministry of Health. And this has changed quite a lot. Like we were the first generation studying global health in Gothenburg, but the latest generation, so the ones that are now first year master students, they're around 50 students. So it has increased quite a bit in the number of students they're accepting per year. So the lectures have a quite varied format. You have one-to-one lectures, you have 2 computer sessions. They vary a lot depending on the course. Sometimes you have 3 lectures per week, and that can go up quite a bit. We have seminars like reading seminars, discussion seminars, presentation seminars. The grading system is quite benevolent here in Sweden, so you get 3 grades. Either you fail, or you pass with distinction. So the passing can be quite broad. And for the evaluation, we get like actual sitting exams. We get to do essays and also oral presentations. So it can vary from one lecture to another. And in my generation, we had a mandatory fieldwork, but I know that for next generations, it would be either a fieldwork or an internship. And this comes in the second year of your studies. All right, so some positives about studying in Sweden is it's a statistical paradise. They have started collecting data like years and years ago, so there's a lot of material you can work with for your research and your projects. Most English people, or all English people I have met, actually have very good level of English. It's pretty easy to communicate, even though I don't speak Swedish at all. Nature is very nice and accessible. We have the opportunity to work with the student visa, and Sweden is all about equality, sustainability, and vegetarian meals. So it's a pretty awesome place to be, and they have a very high standard of living. And a few negatives, as I saw before, accommodation can be quite a nightmare. So you have to start trying to find a place to live as soon as you get your notice of acceptance. And winter is very long and very dark, but on the bright side, summers are also very long and very sunny. And another thing is that it can be difficult to find a job as a non-Swedish speaker. But if you're a native English speaker, then it's easier, or you can be lucky. Like, for example, I got a job with a family that speaks Spanish, like taking care of a patient. So that was very nice. Okay. And just the last bit, I wanted to talk a little bit about the PhDs. So PhDs here in Sweden are paid positions, and they have an application that is very similar to a job. And these are advertised by each university. So there's not a portal as the ones I showed before where you can see all the universities, but you have to go into each website and look them down. Or there's a few websites that I can share with you where you can see information about certain universities. But if you're sure what university you want to go to, I recommend that you every now and then just take a look into their job vacancies, because not everything is posted in these links. And to get into a PhD, then you need to have a relevant master's degree or bachelor and extensive experience. And for all of them that I have seen so far, you need to do your own research proposal. So this research proposal can be either a little bit general, like directed to a department, but you can also choose to direct it directly to one professor in that department. And of course, you also need to have excellent English to be able to apply. So here are a little bit other links. These ones here are for PhDs and research positions. And these ones here are just general links that I think can be interesting for you to see later on. Yeah, so that's everything.
Thank you, Viveka.
Yeah.
Is anyone having a question for Viveka now? You can maybe raise the hands even if, because I can see you all. Okay, I will unmute you now, 1 second. Go ahead.
Hello, Rebecca.
Hey.
Hello. You're from Gothenburg, right? Gothenburg University.
That's right. Yes.
Okay. So actually, I'm applying for SI scholarship. So I was a little bit confused because right now I am doing masters in public health in Bangladesh, but I want to study epidemiology, as well as I have some interest in health system, health financing. In that case, like I have chosen Karolinska first, and I have chosen their public health epidemiology, and they have another course, health financing and management. My second choice is actually Stockholm University. They have population health, and I am little bit confused about my third choice. Like, should I choose Gothenburg or should I choose Umia University? So actually, I searched internet, but there is mixed reviews. Like, someone is saying Gothenburg is great, someone is saying Umia is great. So I'm a little bit confused.
Well, I think the quality, it depends what you are actually looking for, but I think the quality of the studies all over Sweden is quite good. But then you need to decide more about, like, in your specific topics that you want to do, like look into the lecturers and the professors that are working in different universities, and then decide upon that. That will be my like my first thing to look at. And then for the masters, then you can see, like, for example, if you already have a master, then Umeå can be quite a good choice to go for the one that's only 1 year and complement what you already did, because maybe you don't need to go and do a master that is 2 years, right? So you can look into that. The backside of Umeå, I would say, is very north. It's very dark and cold.
Yeah, cold. It's very cold. My friend also said that.
Yeah, but I know some people that are studying there in Umeå, and they're quite happy. And here in Gothenburg, I'm also very happy. So I will look into the professors, and if you already have some things you want to do, see if that's possible.
Okay, Viveka, I had another question. That question is, like, I applied the electronic application, that the deadline is 15 January, right? For subject choice and electronic application, and the document submission is 1st February, right? For SI scholarship. So till now, 15 January, what should I do? Just electronic application that I have already done, like choosing
Sorry, it's getting cut, so I don't
4
actually get.
universities
Can
or
you repeat
1
the question?
university.
Just the last bit.
Okay, within 15 January, what I have to do for application?
I'm not completely sure about, like, you mean for the scholarship institute, for the Swedish institute?
No, not a scholarship, just for applying in Swedish universities.
Okay, for that, I recommend you see the second link that I shared, the one in university admissions.
Okay.
Yeah, go into that one, and there they have, like, the first, you can see, like, let me share it with you.
Okay, okay. Sorry, I'm asking too many questions.
No, no, no worry. But, okay, whatever. So yeah, this is how it looks like. And here you can see actually all the deadlines. So just go into that one and
Okay.
see the specific deadlines. And this
Okay,
is
okay,
for the
okay.
programs, right? This
Yeah,
is for
yeah,
the programs. And then you need to go to the one in the scholarships if you also need to.
yeah, yeah. I already applied through this website to for courses. So what is the next step? I am little bit unclear about that.
I mean, you don't have to apply for the 4 programs. So you can just submit your application. If you
Yeah.
already
Okay.
uploaded
Okay.
the documents, then just submit it and wait for the
Okay. Okay.
notice.
Okay. So I have to upload the documents. That's the next step. Okay.
Yeah.
Thanks. Thanks for clearing the confusion.
You're welcome.
Okay.
Okay, I think we can maybe move to the next speaker. It's going to be Nina, and the last one is going to be Mahima because she's going to go more about the PhDs. So Nina, you have the word now. You are muted. Wait, sorry. You are unmuted now.
So, hi everyone. I don't have a similar presentation. I'm just gonna talk with you. So my experience is from Finland and Sweden. I have done my bachelor and master's degree in Finland at the University of Oulu here in the northern part of Finland, and my major was regional development and regional policy, and all my minors were related to health. But what I'm going to talk with you most is my experience from Lund University, where I completed a master's degree in public health, and I just graduated last summer. So I can share my ideas and what was it to study there. And I think Viveka gave a really good presentation about the application process and how it's going to be. And I cannot really give tips about the scholarship thing because I'm a EU student, EU member, EU citizen, so I didn't apply for scholarships. But I can give some tips or share my experience regarding the application process. In Lund University, when I applied, we had to apply through this website, what Viveka just showed. And we could choose 4 university, like she described. And we had to write a motivation letter, which was the idea was to describe why we want to study in these universities, why in this specific program, and what is our future plans and how this program is going to help us reach our goals. And I found really good online tips for writing motivation letters, so I can share the links here. Because the style depends on the university, they might require you to write about different things. But now, after I finished my studies, Lund University has changed the application process a bit. So instead of motivation letter, you have to answer these 2 questions. They have this document, what you need to fill on their website. And they ask you to, I have it here. It was 2 public or global health issues. Let me check. Yes, which 2 public health issues of global concern intrigue you and how would you like to approach them? And you have 800 words to describe them. So it's not about motivation letter, it's more about how you perceive global health issues, how would you address them. They maybe want to test how you think about these issues and your problem solving or something like that. And then you have to send your CV, but Lund University used their own format, which you need to download and fill. And I think Lund University still requires some work experience. So you need to have some work experience from this field when you apply. And then, of course, the transcript of your previous degree. But about studying at Lund University, I really enjoy that program. It's very well organized. The teaching is really high quality. The professors are experts in their fields. They have worked at the several high-valued organizations. We have a lot of guest lectures. We do a lot of group work. So in every course we do a group work. And how the program is organized is the way that we have one course at each time. So when we are finished with the first course, we move on to the next one. And the program covers topics from health economics, health policy, epidemiology, qualitative research methods, leadership and management, and health promotion and health communication. And we have chance to do internship or 2 elective courses they offer. So I choose to do an internship at the WHO in Copenhagen, which is really good because Lund University is really close to Copenhagen. So you can still live at Lund or Malmö in the southern Sweden and commute to Copenhagen every day. So it was a good location as a university. And then I did 2 elective courses from Finland because my interest is more in social and public policies. So I did 2 online courses. But the Lund University offers elective courses on advanced qualitative research methods and sexual and reproductive health and rights, which you can choose. And the thesis I did, I actually contacted a professor working within my area of interest, and he had a research project going on. So I get the data from that research project and I work with the professor. So I had a really good experience in that as well. But what I would suggest is to, when you choose your university, check the curriculum, what courses they offer. Is that within your area of interest? If yes, maybe then look more information. Check the professors, what kind of work they are doing and what kind of studies they are doing. And then apply if that's what's your interest. But do your background or homework research. Look about the university, what they have done. They usually share student stories on the website, so go and check them. Go and check the alumni stories. For example, at Lund University, they have a lot of that. They have videos and articles about what the previous students are doing at this moment. So that's my Lund University really shortly. And I know in Finland, there is a 1 English master's program in global and public health. It's at the University of Tampere in the southern Finland. And I have heard good about that university. I don't know anyone who has been studying there, so I cannot really say about that. But the system is pretty similar to Sweden. It might be organized in a bit different way, but usually the application period or application process is really similar. The teaching style, the exam style, it's usually pretty similar. But if you want to check that one in Finland, I can send the link there. But I haven't been studying there, but I know that's a pretty good program as well. And what else? I know something about doing a PhD in Sweden, but that's mostly at the Lund University. I haven't never applied myself, but I looked after that. All this information is on the website. So as Viveka said, there's usually no tuition fee for doctoral students. It's usually like a paid job. They have these requirements before you apply. You have to have a master's level degree or the bachelor plus the work experience. You have to prove your English skills. And usually you have to send the research proposal. But all these, at least at the Lund University, all the doctoral education, it's organized at the department level. So the whole process, what they offer, it depends on the department. And this is all on their website. And you can apply for external funding and scholarship. And there's a lot of links and information about that. But I can, if someone is interested, I can talk a little bit more about that. But I guess we have a lot of questions here.
Yes, is anyone having a question? You can just...
I mean, what I want to say about my experience of studying in Finland and Sweden, it's a bit different. There's a lot of same things, like a lot of group works, but the grading system is different in Sweden. It's a pass, fail, or pass with distinction, whereas in Finland, it's usually from 1 to 5, where 5 is the best grade. So that's different. And in Finland, in some programs, at least in my program, we had to do let's say 80 credits out of the 120 about the major subject, and then the rest 30 or 40, 20, we could choose minor studies. So you could design your master's program in a way that it fits your interest. For example, I studied my major, which was within geography, and then I did other studies in public and social policies, in public health, health sciences, health education, sociology. So I created my own master's program, basically. And also the thesis there, you can, like in anywhere else, you can choose based on your own studies and interest. But that's a bit different. And then the courses in Finland, what was my experience was that you might have even 3 courses at the same time going on. You may have classes twice a week, 3 times a week, and then a lot of independent work. Whereas in Sweden, your days are scheduled that you basically study from 9 to 4 or 5, and then you are free. They schedule the courses in a way that they expect you to work, let's say 40 hours a week, and weekends are free. Of course, you can study during the weekends if you feel lazy during the weekdays, but it's really well organized, and the amount of credits is based on specific hours. Whereas in Finland, it was not that well organized. You could choose how much you want to put effort based on yourself. But that's the difference I found. But here are the questions. Oh, yeah. What I found in Finland and Sweden is that there is usually no application fee for PhD application. They usually, when you apply for a project or university, they have funding for that project. If you're applying for this specific one during the open application process, they are advertising. Or you can find your external funding by yourself and make a research proposal for the university and get insight in through that way.
Nina, you also said that you know something about Denmark. I'm not sure if someone is interested because she can.
Oh, yeah. The only thing I know about the public health in Denmark is the University of Copenhagen. It's a global health. It's 2 years master's program in English in Copenhagen. But I haven't heard about that. How is it organized? How is it studying in Copenhagen or in that university? But I know there's one program there.
Okay. Is anyone having some questions for Nina? If not, we can go ahead to Mahima. She will talk about her PhD experience. She's from India and living in Norway. Thank you, Nina. And Mahima, you can have the word. Let me unmute you. Now you can talk.
Thank you. Hi, my name is Mahima. Sorry, I'm just getting a call. Yeah, so like Andrea said, I'm from India. I'm from Chennai in South India. I did my medicine, my medical education there. I worked for some time after that. And then I did my master's in global health at Maastricht University in the Netherlands. Maastricht has a Maastricht India partnership, and I got a scholarship through them. And this global health program, Andrea also did that program, right?
Mm-hmm.
Yeah.
I did that.
But we were not in the same batch.
No, I was the health policy. I just finished last year. Yeah,
right. And then I was living in Germany for a bit. I was a research assistant in the obstetrics and gynecology department at the University Hospital in Cologne. That was for about 3 months when I applied to a position in Norway. And that was a PhD position. So the way I found the link, or the way I found the job application, was through LinkedIn, of all places. So that is kind of just an illustration of the different kind of places that we should kind of look for or keep our eyes open to, because I had the same questions as some of you here, as I see in the chat, of where should I look for these job applications. So the answer is everywhere, right? And I had a Skype interview for that PhD position. I sent in a motivation letter I sent in my CV, I sent in my copy of my grades and so on. And then I was called for an interview. And the interview was, it was quite unstructured in a sense. Nothing about science was really asked. So it was all about how well can I work in the team. There was a mini personality test. And then the person who was interviewing me, who's now my supervisor and boss, he tried to compare it with other people that are working in the team. And that was a completely new experience for me as well, because I was more prepared to field questions about research methods or what I can do if I get the PhD and so on. And luckily, I did get the position. The person who was the person who was first choice on the list declined, so and I was second. So I think I was really lucky there to get, the timing was just right, I guess, because the first choice person was, she took another job or something like that. So I moved to Oslo, and the research team I'm working with now, we do electronic registries and electronic health information systems. It's called the e-registries. I'll post it here. You can check it online. So basically, the project I work with is based in Palestine. I was asked in my interview if I was willing to travel there, how much field work I could put in, what kind of family commitments I have, and so on. So sometimes it really helps to just show that your willingness to do something might actually land a PhD. At least that was from my experience. So in this project, it's a large implementation project. So it's a European Research Council funded project. I did not have to write a research proposal. This was, the project was already funded for 5 years when the position was open. And that's a very common way of getting into a PhD. I think both Nina and Viveka, they both mentioned that you apply for a PhD like you apply for a job. And that's basically what I did. But having said that, after I started in the position, we had to rewrite the whole protocol. I had to rewrite what I wanted to do within the PhD and what we wanted to do as a project. So oftentimes what happens in projects like these is the protocol that is written up for funding is quite broad. The operational aspects of it are not really figured out. So you have a slightly larger role to play than a PhD student in the traditional sense of the word. So this was also a different or new experience for me. And now I'm in the third year of my PhD. I have a year of funding left. So the process was kind of twofold for me, because I am at the Norwegian Institute of Public Health. So when I applied there, I applied like I was applying for a job, but I had to register as a PhD student at the University of Bergen in Norway, and that was a separate application process. For both of them, in my experience, the most important advantage was having a master's from Europe. That made the whole process much easier, much more straightforward. There was no conversion of credits. You had something that was equivalent to Norway, and that made the process much easier, much smoother for you. And that has, from my own experience and from my experience of my co-PhDs and colleagues and so on, this has always been the observation. Of course, when you have a master's from somewhere else, it is possible to get it equalized and so on, but the process is much longer. It takes more steps. It involves more people. You have to apply to the Norwegian Higher Education Agency in case of Norway, or in Sweden, and so on. So getting into a master's in Europe could be a good entry point in order to start with a PhD. So this is my experience. The other side, the other possible way of getting into a PhD is actually writing your own research protocol and trying to get funding for it. So now I'm only speaking about Norway. I'm not very sure about Sweden or Denmark, any other places. But The downside of that is you need to have a strong research team. You need to have some kind of contacts in order to make this application good. But on the plus side of it is you get to decide what you want to do research in, because this is something that you will be stuck for your entire life. So it has its plus sides and positives and negative sides. But especially for people who are not from Europe, it might be a bit more challenging to actually go down that route of writing up a research proposal and actually getting funding for that, or finding people who will work with you towards that, just as the first step. If that is going to be the route that you would like to take, then my advice would be to start with some kind of a public health position as a research assistant, or as find a job or something that you into a bigger research team that actually supports you, or lends their name in a way to that research proposal. Yeah, a little bit of the practical stuff about courses and so on. You need only 30 credits when you're doing a PhD. So you take these credits from the university. That is near complete academic freedom. You choose the courses you want to do. You choose when you want to do them. You kind of shape your research questions. You go ahead and do write up your papers and write up your publications. You can do much more than what you do traditionally would do as a PhD student, especially if you're part of a bigger project. But that can also be a negative side of this whole thing, because if you need guidance, right? Like there's a reason why we are PhD students, because we need some guidance in doing research. And sometimes I think it can be a bit extreme of not having enough guidance, especially if you're part of a smaller research project, you're sitting somewhere, you're doing your own research, you're meeting a supervisor maybe once in 3 or 6 months. All positions are paid. It's a job. You will get a job visa, and which means you also pay taxes, and it's just like a job position. There's no, and you are a student in addition. That's how the system works in Norway. You get paid well, but maybe it for me, at least when I was offered the job, I thought it was a lot of money, but it really wasn't a lot of money. It's enough money for living expenses and to lead a comfortable life here. But Oslo is quite expensive. Housing is really expensive, but your PhD salary will cover them. So that's probably the biggest advantage of this. Now, what can you do after PhD here? You can do, in all honesty, you can do little if you don't learn the language by the time you finish with your PhD. It doesn't have to be a very high level of knowing Norwegian, but you need to know some Norwegian, because university settings, university research groups, and so on, they have this protected environment where everyone speaks English. But if you want to move on into the public sector, if you want to work in Norway, if you want to work anywhere else in Scandinavia after your PhD as a postdoc or a job or something, then some amount of Norwegian or Swedish or whichever language country you're in, that definitely helps. Yeah, so pretty much you get a degree that's recognized anywhere else. You can go into a postdoc or get a job, or depends on what your interests are. Just by show of hands, how many of you here have finished their master's and looking for a PhD? I see 2. Is that all?
I think
Okay.
Sabrine Has Yuchen, Blessing, I think she also, Viveka, yeah, me too.
Yeah. Okay, so just wondering because for masters, it's the admission for masters is much more standardized, but for a PhD, it's very. Of course, there are useful links and so on. I can show you some of them for Norway. Okay, so this is one.
Global Health.
This is called globalhealth.no. This was launched last week, and this is kind of an effort in Norway to consolidate global health efforts in Norway within the universities here, and the research schools and public health institutes and hospitals. This is something, well, I don't think you can really find anything about how to find a PhD, but it's just interesting nevertheless, just to see what kind of funding opportunities there are for bigger research groups. But if you want to look for PhD positions, then you go into this website. It's called Jobb Norge or Job Norway. And you can just use Google and it translates it for you to English. And then you go into the job search field, and then there are different areas you can pick from here, the different areas within Norway, the regions in Norway. And then there's also the categories of interest, but you can also do a search of jobs in the university, for example. I'm sorry, my computer is really slow. So there you have, this is the University of Tromsø up in northern Norway. And you will see that most of these are mentioned in Norwegian, but that does not mean that these positions require Norwegian. Most, if not all, PhD positions do not require Norwegian language skills, unless it is something that they have to do in that you have to do in the field. None of the global health positions need Norwegian language. Not in the PhD, not for a PhD application, no. So, and some of them will be in English, and they're obviously positions in English, but what I would like to stress is you can go, I suggest you go into these positions and check them as well, because although the position title might be Norwegian, they would probably not expect Norwegian knowledge. So that's one. I can send you all these links after as well.
Mahima, sorry, there's a question from Sabrin. She asked if there is an English version instead of using Google Translate on this website.
No, wait, there is. Yeah, it doesn't, well, it changes these. If you see job admin, find jobs advertising about us to English. And then it changes all this. The website changes into English, but the positions do not. You see them here. I didn't know any Norwegian when I moved here, and I just used some keywords. And if you do this search like a few times, I think you pick up on some words, and then you can easily scan through them after. But there are some jobs that will be directly in English, and I'm trying to find some of them. So this is another website. I'll send you the link to this one as well. And it's posted as a job position. So that's why you go into these positions where they, for example, they advertise they're looking for somebody to work in a supermarket or like a distribution center or whatever. So that's kind of the same portal where you would look for a job as well. as strange as it sounds. Trying to find the position in English for you. No, there's nothing yet, but this is where I work at the Norwegian Institute of Public Health. Here it says they need a department director. But that's not what we're looking for. But this site also works very well with the Google Translate. It translates almost everything, and at least enough for you to navigate through the website. Apart from that, there's the University of Bergen, and this is the vacant positions at the university in Bergen. For example, here there's an English, like it says postdoctor, so it's postdoctoral in computational biology unit. And this is the word for a PhD. Let's see if this application is in English. Yeah, so when you click on it, then the entire link is actually in English. So this is an example of a project like probably like what I work with, where they have already defined something, they have funding, and they have funding for 3 years for a PhD student. And then there's qualifications and so on, and we can offer, and they also mention what kind of salary they offer right here. This is an average Norwegian would make about 450,000 a year. So this is almost as good. And then for this one, they actually want a research proposal of 5 to 8 pages. But it's a bit easier because you go through the bigger project application, you go through what they have actually applied for funding, and then you try to define your own research within that. This one doesn't have to be very well planned out, but it has to make some sense. I had to write a similar proposal as well, but it was only for 2 pages, I think, of just what I would like to do within the bigger project. Yeah, so this is at the university. Some of these positions have teaching responsibilities, some of these have fieldwork responsibilities. So it's very like individualized. So I'm not really sure what else would be interesting for all of you. So that's for the university in Oslo, and then the same thing with the university in Tromsø. And then they have a PhD candidate in computer science. It's directly in English. There's a research fellow and so on. And then there's a university in Trondheim, which is also another university in Norway, which has its own list of open positions. So yeah.
I think that's it. Is anyone having some questions for Mahima and for all the other girls? Now is the question time. I know some of you, if they ask if it's needed to have a research proposal. So sometimes yes, sometimes no. It depends on university.
Yeah.
Do you want to go more in detail about that? Because maybe they can talk, or maybe Mahima is also good to tell that they could also contact the professor and write the research proposal together.
Yeah, that's another way of doing it, but that you need to be very resilient for that. Like, so I have tried doing that before I got this position as well. And you just find a list of people that are interested or that work with the topic that you're interested in, and you just send them an email repeatedly until you get a response that you are interested in doing this and you would like to write a research proposal with them. Sometimes, at least in my group, we've had 3 different people who have expressed interest like that with my supervisor. and they have been offered positions as research assistants first. And then one of them managed to get into a PhD after she wrote a research proposal. So some kind of flexibility from your side, that definitely helps. So if you're willing to work on a data set, if you're willing to work on something else in order to get into a PhD position, that's also very highly appreciated. And like I said, very often, even if the bigger project is very well defined, they would expect some kind of a research proposal from you. Some positions don't need a research proposal, but some they may ask you to write an essay, which has happened as well, or like a scientific, not an article, but a scientific write-up on some method, for example. So that is also another way of doing it. So if any of you who's interested in actually applying for a PhD, I know all of you are interested in applying for a PhD at some point, but if for those of you that have that kind of know what they want to apply to, if you could like explain your situation and or interests, then maybe I can directly address them.
Now is the time for questions.
Yeah.
Has, maybe you can ask your question here.
Okay. My question is like you have said that there are some positions for PhD, right? So there are lots of openings like postdoctoral fellowship, research fellow, research assistant. So how can we understand, like people who are new like me, how can we understand like which posts are actually is a PhD position?
So for one, if it's in English, it will state specifically that it is a PhD position.
Okay.
And if it's not very clear from the title, if you just if you click on those links, if you go into the actual job description, there will be some requirements. So in order to do a PhD, you need to have a master. I know the people who have more experience in Sweden mentioned bachelor with extensive experience, but as far as I know, that doesn't count in Norway. Even if you have extensive experience, you need to have a master's. It's something about the credit system in Norway, and you need to have this 5 years of education and so on. So yeah, so for a PhD that would be the requirement, but for a postdoc you would have to have a completed PhD.
Okay.
Yeah, and for a research assistant it depends. Some of them need a master, some of them don't. Some of them need a bachelor with some experience, maybe a publication, for example.
Okay.
So that's how you distinguish between them if you do not understand it from the title itself.
Okay, and another question is like, other than going for PhD, what are the available opportunities for like masters completed students?
Right.
Apart from a PhD?
Yeah, apart from PhD, what are the opportunities student can grab after completing their masters?
So you can still apply for research-based positions and not do a PhD. And these research-based positions, again, they fall under bigger projects. And officially you might have the title of a public health advisor or a researcher, for example. Now I'm talking about Norway and Scandinavia.
Okay.
Right? And then the other possibility is to, of course, go into policy making or into the public sector. Yeah, so, and or development, of course. So you go into more development work, implementation of projects, field work, and so on. Again, I'm only talking about Norway or
No, yeah.
Scandinavia. Yeah.
Yeah, I can actually, because I finished my master's degree and I'm not planning to do PhD within the next years. And what I'm doing right now is that I work for public health institution or organization, and it's a research project. So I work as a research coordinator. So you can go to the research part, and some of my classmates are doing that. They are working in a research project as a researcher or as a research assistant. And some go to work at the NGOs or other projects from governments, municipalities. There are a lot of options. It depends on your areas of interest.
Okay. So it is better to have some experience before applying for PhD, right?
I didn't hear you that well. Can you repeat, please?
Okay. So it is better to have some work experience before applying for PhD. Is it right?
It depends on the position you would like to apply to.
Okay.
So if the position involves work that actually would need field experience, for example, with data collections or patient care or an internship experience, then that will be valuable for you. But otherwise, I would say that from my experience in most interviews that I've heard about or been part of at the other end of being with my supervisor, while experience looks really good on the CV and it'll help you get shortlisted, your master's grades probably matter as much as well.
Okay.
Again, it's very dependent on who gets to interview you. It will mostly be your supervisor, especially for a PhD position, and each one of them has their own kind of preferences, right? Okay. So as much as experience is, I would say, an experience is as important as master grades.
Okay.
Yeah.
I just quickly, I totally agree with that. And it depends also on the person, because I didn't want to go directly because I wanted to see how is it to work in the field after studying, to get more idea what I want to do in my PhD. So it also depends on the person and your interest. I want to see how it's in real life compared to university, and then decide where I want to do my PhD.
Yeah.
Mahima, there's Yuchen wants to talk something, so I'm gonna give her the word now.
Sure.
Oh, 1 second, it's still muted now.
Can you hear me?
Yes.
Yeah.
Yeah, so thanks for all of your presentation. I think it's very helpful to know, because currently I just completed my master degree in public health and in United States. And right now I'm like kind of want to pursue PhD position. So I did some application in United States, but I also want to apply for some position in European country as well, especially after hearing your presentation. I find there are a lot of different opportunities. So basically I have some questions. So first I want to know, like, the PhD in general in Europe can be completed within 3 years, right? Like in general, if I have a master degree.
Or 4, depends.
When I started my PhD plan was to complete it in 3 years.
Oh, okay.
But now it's been extended by a year, and judging by the progress, I think it'll be another year after that.
Okay, I see.
So,
then also, yeah, go ahead, sorry.
Yeah, so in my case, we had to set up a research project and then design a data collection system, collect the data, and then analyze the data to write up the papers.
Okay.
but and it's very varied. So in some cases, you get a data set to start with.
Oh, okay, I see.
And then
And
you design a research question.
Mm-mm.
Not to say that that may be done quicker, that might be more complicated as well, just because of the statistics involved.
Mm-mm.
But at the moment it goes out into the field, I think it's more unpredictable.
Oh, okay, I see.
Yeah.
Another question is because particularly my background in public health is more about social and health science. So my master program is health education and communication. So when I search some position online through the website you listed, I find a lot of them has to do with health. My
We cannot hear you.
PhD position about health. Sorry, can you hear
repeat
me?
because it was interrupted?
If okay, so I can repeat my question.
Yeah.
So if I still want to find some position to stay in the health promotion or social behavioral science field, like which program or university you would suggest me to keep my eye on to kind of keep looking to see if they have position posted?
So from Norway, I would say University of Oslo and University of Bergen. Those are the two universities that have the biggest global health or health promotion, public health focus.
Okay, so can you type the name of the university?
They're already there.
Yeah,
If you
sure.
look,
Okay.
they are the three on.
Type the names of the universities.
Yeah. And also in terms of, sorry, one more question for, if right now I do have a specific research proposal, but like you said, so I have two ways. So the first way is I can reach some professor to say if they have like an opportunity for the PhD. But I think probably a lot of position when I find online, they have specific project topic. Like for example, my particular interest in non-communicable disease, but probably a lot of them are about like HIV or that, and like other area I don't have a lot of experience. So do you think I should like not to apply those positions because I don't think I have like enough expertise, or should I just reach like specific professor to say if they have research assistant opportunity at first, then if I can get the research assistant position, then ask her for a PhD position opportunities?
I think the answer is you should do both.
Okay.
And I think Yuchen, your profile is quite good for Europe. And I know Yuchen because we worked together at WHO last year, and she studied at Johns Hopkins, so which is world renowned everywhere. So in Europe, that's gonna help you as well because of the reputation of your studies.
Oh, okay.
And
As
most
far
of the
as
studies are
PhD
focused on NCDs.
Sorry.
Yeah, exactly.
So a PhD is, of course, you're specializing in something, but how you choose to do it is up to you. So even if you, for example, decide to move away from non-communicable diseases because you think that a position is really interesting and good, what you learn more than what you learn, as much as you learn about the topic, you also learn methods.
Yeah,
right?
exactly.
So if you're working with a team that works with novel research methods, different types of analysis, then you can use that after your PhD in order to do non-communicable disease research.
Yeah.
So it depends very much on what you make of it, because of course you need to know your subject really well, but it is equally important to know how you do research, right?
Yeah, that's
and
true.
I think, at least in my PhD, that has been my biggest learning experience, more than actually reading up or becoming more experienced with the topic itself, is to identify what is good research and what is not. So I think if you decide on a PhD based only on the topic, you probably lose out a little bit than if you choose something for a bigger purpose, as an opening into something.
Yeah, thank you for your suggestion. Yeah, I'm ready to like change to another topic, but I feel like if I apply for those topic area, I did not have experience, probably I'm not competitive enough as other people who had a lot of experience in that area. So yeah, that's my concern.
Yeah, I understand
Yeah.
what you mean. But again, it depends on who your supervisor is or who's the person that's interviewing you. Because my master thesis was in adolescent health, and
Yeah.
my PhD now is in maternal and child health.
Oh, okay.
And that was apparently it wasn't a problem because the focus was on what kind of methods did you use? Did you use statistics or you know, all kinds of questions like that rather than actually in the topic.
Okay. Thank you very much.
You're welcome.
Anyone having other questions? Now is your time to ask them. You can just raise
I would
the
like
hand
to.
and I can see you.
I would like to just add for the previous. It was really good discussion, and when I was looking for the PhD position here in Finland and Sweden, I noticed that I was too narrowed. I was looking too narrowly on the Faculty of Medicine or Faculty of Health, because they do also this kind of research at the Faculty of Social Sciences or Behavioral Sciences or other departments. So don't narrow yourself too much. And you can maybe suggest that research proposal to other departments or faculties, and they might be interested.
Thank you. Thank you.
Yeah, the same thing happened to me. I also applied for a PhD in Sweden and I got in, but it was a university I never heard about, and I just found it on a website, and they asked a research proposal, and that's it, and they had 16 openings, so quite a lot, and they just say, okay, you have to apply and with your own research proposal, and it was quite short, like 2 pages, which is quite easy. You can do it within a week, or depends if you have some idea of what you do and based on the requirements. So just also to try to look at big websites like Euraccess or findthephd.com. There are some websites, I posted them here. They might help you with your search as well. Academicpositions.eu, that's also another one. Any other question? Also for masters or anything? Blessing, do you want to say something? Oh. Anyone else?
I have a comment, I think. It's PhD is great, but it has some or a lot of downsides as well, and they are smiling now. Just not to discourage or anything, but I want to quit every day. So, but yeah, just to say that you should probably really like the topic. And it's okay to choose something that's out of your comfort zone, but once you choose it, I think you should just go all in with it.
And also think about, where do you want to go in the next 10 years? Like, what is your goal? If the PhD helps to reach the goal, then choose PhD. But if you want to work on more grassroots level or a small organization, I would really carefully think if the PhD is the right thing to do.
Yeah. On that bright note.
Any other questions? Or tips?
Mahima, I had a question.
Yeah.
Okay, you said something about e-registry or something, right?
Yeah.
Yeah, what is it about?
So in our team, we have we work with electronic registries for mother and child health. The idea is you collect data through an electronic system from the primary healthcare clinics, and this is designed for primary healthcare. And then
it's your research.
Sorry.
It's your research proposal, or you are working on this?
So at this point, I think it's at this point it's very interconnected, and I cannot say which one is part of a bigger project and which is part of my PhD. but we have a project, one in Palestine and one in Bangladesh now. And probably Ghana comes up next year as well. So it's a collaboration between Norwegian Institute of Public Health and public health institutes in Palestine and ICDDRB in Bangladesh.
Oh, I'm also from ICDDRB. Like my campus is in ICDDRB.
Okay, yeah. So that's where the project is. That's where the collaborators are.
Okay.
Yeah.
That's it.
Anything?
I have just one tip for the motivation letter, or whenever you're applying for a master's program or doctoral, please proofread your documents and the motivation letter by someone. Just tip, whenever you're applying to anything, just proofread it by someone else a lot.
Okay.
Don't make mistakes. For the CV, it applies the same. They are actually going to cut you out if you just have mistakes
Yeah.
in your spelling while you're doing a CV or a cover letter. Monty or who is Blessing? Any questions? No?
So I think the motivation letter is maybe I can add something to that. Its importance cannot be stressed enough. I've literally seen applications being selected or not because of a motivation letter. There have been part of discussions where people have said, oh, she doesn't really have the skills for the job, but the motivation letter is really good that we have to interview her. So I cannot stress how important it is. Like Nina says, it's definitely worth spending enough time on it, on proofreading it, having somebody else read it, having 2-3 people read it before you send it.
And especially if you apply to, like in Swedish case, you can apply to 4 different universities, and don't use the same motivation letter to each university. You have to specify it, because if you use the same one, it's not really personal and it doesn't really show why you want to study in this specific, because the programs are different from each other.
Monty made a question on Pigeonhole. I don't know if it was answered. She asked that PhD funding opportunity for international students. Monty, did this question was answered for you enough? Because Viveka talked about it on her presentation, but like, and also Nina talked about it, but I don't know.
Yes, now I understand, because I got it that in Sweden, Norway, everywhere it is like a job position, not any scholarship things. So now I got to it. I got it because it is. I have to find through the different links, but I have just noted down.
Okay. Yeah. Just to make sure, because I just read your question, so just to make sure about that. Perfect.
Thank you.
And some universities actually share links, so they have useful links where you can apply for a scholarship for PhD studies, because they might have some funding, but you still need to find some external fundings. But they usually provide useful links. It's same with the master's program. At least at the Lund University in Sweden, they have several places where you can apply for a scholarship. So they usually offer a lot of information.
Sounds good. Thanks, girls. Is anyone who wants to hear anything or just ask anything else related to these topics? Studying? No one? Nothing? First time, second time? Go ahead.
Okay. I want to say it's not a question. It's actually like I'm feeling very happy that Global Health New Generation Young Network arranged this session because it is really helpful for students like us. Like I'm from Bangladesh, and I really want to study in some good universities and want to have that kind of experience, study experience. And also I want to make my profile great. That's obvious, right? Everyone wants that. So like this session is really helpful, and I also want to say that these links will help me. And after what Mahima said, like PhD is stressful, and I'm always afraid of PhD. So after having a MPH, I am also going for another master's because I feel that I need to know more about my subjects. And another request to you guys, like if is there any opportunity of collaboration, opportunity of research work, opportunity of publication, opportunity of conference, seminar, just be there for each other so we can make this world more great. That's it.
You can always contact us. We are going to also put the emails. I think we are going to send you an email after the talk, and then we can also give it our email.
Okay.
So you can contact us also through Facebook, and we are also on the group.
Yeah.
So we can help each other and network. And
Yes. I want that network, seriously.
and if you need help, for example, with your application, and we studied abroad already, you can contact us, and then we can help you, or we put in contact with someone else from our network.
Okay.
And so also we have our conference.
Okay. Whenever I will.
And of course, I'm the news writer, so of course I need to advertise this. If you have a topic you want to share with us, we publish articles online, so you can write, and we are happy to.
Of course. Yeah, of course. And I feel that I'm also part of Global Health Young Professional Network. Seriously.
Yeah, that's good. You can also join our newsletter, and we are going to advertise there's as well some option.
Yeah. Okay.
Okay. Well, I think we finish. Well, thank you everyone for joining. And also, of course, you can keep an eye on our social media because we are going to have future sessions. Also, it's going to be about the Netherlands, studying in the Netherlands, Germany, Belgium, also finding an internship at WHO or other World Bank, UN, because many of us work there. So we can give you some tips on how to get them. And keep an eye on our social media, and also send us an email whenever you want, either to peer-to-peer sessions or to the, you can look on the global, I'm going to send you the email, Global Health Network.
Okay, and another request, like please make a peer-to-peer session only on job opportunities. Okay.
We are going to have that as well.
Yeah. Okay.
And we are also working on a new project which is related to jobs. Okay. So that I will let you know about that soon.
Okay. Yeah. Okay. Thanks a lot.
Thanks everyone for joining, and we keep in touch. You can always write to us.
Yeah, of course.
Feel free, just write to anyone. Bye. Good night.
Okay. Bye.
Or good evening. Good day. What different times. Bye.
Yeah. Okay. Thank you.